Hey guys, Dr. Childs here. Today we're going to be talking about 7 things you should know if you have thyroid disease. So we're going to be talking about how thyroid disease impacts your life. If you're someone who's been newly diagnosed with a thyroid problem of any type, or if you're somebody who has had thyroid problems for a significant amount of time, these are things that hopefully that would be ideal for you to have known before you had your disease. But even if you already had it for some time, it's not too late. So let's talk about living with thyroid disease, living with hypothyroidism, living with hashimoto's thyroiditis, what that means for you, and what do you expect, right? Because that's really important. So number one is I want you to know it will be harder for you to lose weight compared to somebody who doesn't have thyroid problems. Now, this doesn't mean that it'll be impossible for you to lose weight, but it does mean that you're going to have to be more aggressive. It also means if you have, let's say, a girlfriend or someone else you know that's doing some sort of therapy, let's say they hop on the ketogenic diet and they lose 20 pounds. Well, if you were to do the exact same thing as them, you're probably not going to have the same results as they do. In fact, your results will probably be muted by about half of that potentially. So if somebody else is doing something and losing 10 pounds, you can probably expect to lose about half of that weight. Now, this changes if you can optimize your thyroid function. We'll be talking about these in later options. But if you're somebody who goes to an endocrinologist, goes to a family practice doctor, is just getting the standard treatment with levothyroxine, the chances of you optimizing your thyroid function and living, your best life it's pretty slim. Okay. Again, that doesn't mean that it can't get better, and we'll talk about that as we go. But I want you to be aware that weight loss is going to be something that's going to be more difficult for you because you have a thyroid problem until you can optimize your thyroid function or get back to 100%. Number 2, doctors may not take your symptoms seriously. All right, this is very frustrating, very confusing, and it's just something that it's just the reality of the situation right now. Now, doctors, they look at thyroid function in a very specific way. They look at diagnosing and treating thyroid problems in a way that is not really up to date with the current medical research and current medical science as it relates to thyroid physiology. They're sort of stuck back in a 20 or 30 year old paradigm of treatment, which is just check the TSH and use levothyroxine. As a result, they think that if your TSH is normal, that your thyroid is completely normal. So what often happens is you will have thyroid patients who come into their doctor and they say, hey, I'm still depressed, I'm still gaining weight, I'm losing my hair, I'm having all these symptoms. And the doctor will look at your labs and say, no, you're normal. Therefore, whatever problems you're having, they aren't related to your thyroid. Now, if you are a thyroid patient sitting in isolation, experiencing this, you're probably thinking you're crazy. In fact, your doctor may even say something like you have depression. It's not actually your thyroid, but you're not crazy. In fact, the whole reason I have my channel and my website is because I'm giving information to thyroid patients. So if you look below, look at the comments on this video or any other video, you'll see that everybody else, well, not everybody, but a large portion of people are experiencing the exact same issues as you. You're not crazy. You're not just depressed. It is your thyroid. Now, the reasons for why you're not being treated appropriately, that's sort of outside the scope of this video, but I want you to know that what ends up happening because of the way that your doctor looks at thyroid function, they're probably not going to be taking your symptoms seriously. They might also be trying to convince you that your symptoms are related to depression or aging or hormones or some other cause, right? And this, again, it leads patients to feel that they are crazy, even though, let me assure you, you are not crazy. It is 99% likely that it's your thyroid causing these symptoms and not something else. Number 3, some thyroid problems can be reversed or cured, but not all. So it is the case in some individuals that they have reversible causes of low thyroid function, which is great because what ends up happening is a lot of doctors will tell people, they'll say, hey, you need to start this thyroid medication because your thyroid is low. Also, just FYI, you're going to be on it for the rest of your life. That doesn't have to be the case every single time. Now, it's not always the case that these things can be cured or reversed, but I at least want you to be aware that some can, okay? Especially if you catch your thyroid condition early, or it's related to a nutrient deficiency, or it's potentially an early case of hashimoto's thyroiditis. These are potentially treatable conditions. Now, not everyone who has these conditions can reverse them. Not everyone can put them into remission, but it is a possibility for many people. And in fact, I think it should be your goal in the very beginning, whenever you're diagnosed with thyroid problems, to try and reverse that condition. If you can do anything, if your mindset should be, okay, I'm not gonna have the mindset that I'm going to be living with this for the rest of my life and I just have to deal with it. Your mindset should be, let me do everything I can right now. Let me be as aggressive as possible to do everything I can to potentially get off of thyroid medication or fix or cure my problem. Now, along the way, you might find out that that's not possible, but at least you've given it your all. At least you change your mindset, and you will probably have done a lot of good in the process. Because the last thing you want to do is have to be reliant upon thyroid medication for the rest of your life, going to doctor's offices every 3 to 6 months, getting your labs checked all the time, feeling poorly, et cetera, and having to deal with this system. If you can get out of it, that would be the best, right? Again, it's not always a possibility, but it should at least be your direction, or the direction that you are trying to take when you first get diagnosed, or regardless of where you're at in your diagnosis. Even if you had it for 10 years and you didn't take this mindset in the beginning, do it now, because there's a lot of benefit along the way. And I have tons of videos which explain how to do this, how to change your diet, exercise more regularly, manage your stress, get better sleep, etc. All those things can potentially help your thyroid, and there's things that you should look at. So number 4 would be, some days you are probably going to feel better than others. So it's probably going to be the case that you will have ups and downs in thyroid function, and the reason for this is simple. So when doctors replace thyroid medication in your body, they're giving you a thyroid medication that you are supposed to take once per day. Now, this is not at all the way that your thyroid is normally functioning in the healthy setting, right? In a healthy person, your thyroid is constantly producing more thyroid function as it needs throughout the day, and as it needs in response to stressful situations. But what happens is, when a doctor gives you, let's say, 100 micrograms of levothyroxine or Synthroid, you're taking that 100 micrograms every single day, hopefully the same time of day, Monday through Sunday. But what happens if you have a particularly stressful day? You haven't changed your dose, but your thyroid, if it was working better, would have done that automatically for you. But because you're taking a thyroid medication, you don't have the ability to fine tune the same way that your own thyroid gland would in a normal setting. So what ends up happening is that if you have a particularly stressful day, or if you have more demand on side of your body, or demand on your thyroid gland, your medication doesn't compensate for that, which means that you might have days where you feel better and days where you feel worse, and you kind of fluctuate like this. So you should be aware that your thyroid function, because of the way that doctors replace thyroid medication, is not always going to be consistent. Okay, there's going to be increased demand, and the changes to your body that it goes through under these stressful situations, or when you exercise more, or maybe you've lost weight, maybe you've gained weight. All of these things can impact how much thyroid hormone your body needs. Which kind of brings me to number 5, which is the next one, and that is, your dose of thyroid medication will likely change throughout your life. So a lot of people will think, wrongly, they'll think that, well, once I found my dose of thyroid medication, I can just be on that forever. Maybe I don't need to go see my doctor anymore, and I'll be fine. I'm taking this 100 micrograms of levothyroxine for the rest of my life. That's definitely not going to be the case. In fact, what ends up happening is, a lot of people, like I said before, they get into a stressful situation. Maybe they've gained weight. When you gain weight, that impacts your metabolism, it impacts your thyroid function, and it impacts your demand for thyroid hormone. In fact, if the more weight you gain, the more likely you are to need a higher dose of thyroid hormone. So if you gained a bunch of weight, and your medication has stayed the same, you should go back in and see if you need to get evaluated to have that dose adjusted. And likewise, if you lose weight, it's true on the flip side as well. If you're doing natural therapies like changing your diet, taking supplements, managing your sleep, maybe using sauna therapy like I talked about in previous videos, these all might help your thyroid function more naturally, which means you might need less thyroid medication, which would be a great thing. So no matter what you're doing, you should always be keeping an eye on how much thyroid medication you're needing at any given time, because that can change and probably will change throughout your life. So don't have the mindset where you found your dose and that's it, you're going to be staying on that dose forever. It's probably not the case. Number 6, you may not need to be on thyroid medication forever. So what we've been finding, there's been a lot of studies on this, but what has been found is that there's a lot of people who are told, hey, you're going to need to take thyroid medication for the rest of your life. And a lot of people I've seen have been on thyroid medication for 30 or 40 years, and no one really stopped along the way to ask, number 1, why were you put on thyroid medication? And number 2, is it possible for you to get off? So even though it may have been the case that you needed to be on thyroid medication in the past, it may not be the case that you need to be on it now. And that kind of goes along with what I said previously. There are some reversible causes of hypothyroidism. And believe it or not, some of these things can be reversed without you really even paying attention to them or trying to fix them. All right. A lot of the times the body can just take care of itself if the inputs are good. If the inputs are healthy and you're putting good things into your body, even without consciously doing so, your body can naturally regulate and fix itself. And now what will happen though is a lot of patients the doctors and patients won't necessarily know that this occurs, so they'll never actually try to get off their medication. So it may be the case, if you're listening to this and you've been on thyroid medication for a long period of time, it may be the case that you can get off, that whatever caused you to have your low thyroid function to begin with is not necessarily causing the same problem in your body now because of however long ago it was. And in fact, when you look at the studies, there's a pretty good percentage of people who can get off of their thyroid medication. In fact, some studies put this as high as in the low 30 percentile range. So maybe 1 out of 3, or maybe let's just say 1 out of 4, 1 out of 3 people might be able to get off their thyroid medication, either because they were taking it inappropriately to begin with, or because whatever caused that problem is no longer there. It's no longer causing the issue that they have low thyroid function. But nobody's going to know that unless you try to get off your medicine. And this is something that you're going to have to bring up to your doctor. I can almost guarantee you that no doctor is going to be like, should we get off this thyroid medication right now? You're going to have to be the one to initiate that conversation, which is why this is something important for you to know about. Number 7. If you are treated correctly, you can get back to 100% or close to it. So I know some of this stuff may seem like it's a little bit of a Debbie Downer to you. You may be thinking, wow, this is something I'm going to have to live with for the rest of my life. Or wow, my doctor doesn't know what they're doing, and my treatment is going to be terrible, and yada, yada, yada. So it is the case that if you are treated correctly, if you use the right type of thyroid medication, if you optimize your dose, you can get back to 100% of normal function before you had your thyroid problem, or at least very close to it. The problem is most people are living at probably 70% of normal, 80% of normal, some fraction of what is normal for them, because they're not being treated correctly. But what I want you to take away from this is that it is possible to get that correct treatment and to increase how you are feeling back up to as close to 100% as you can get, provided you get the right treatment. So even if you are somebody who can't get off your thyroid medication, even if you're somebody whose thyroid condition cannot be reversed or has to stick around with you forever, that's okay. Because guess what? If you do it the right way, if you get on the right treatments, if you use the right types of thyroid medication, if you get seen by the right doctor, if you use the right supplements, if you sleep and exercise and do all these things I'm talking about previously, you can get back up to very close to 100%. It's always been the case that somebody can get to 90, 95, 96, 97% of whatever was normal for them before they had thyroid problems using these therapies. So like I said, don't lose hope. There are still things you can do. Now, is it going to be easy? Probably not, okay? It's going to take the help of a doctor. It's going to take a lot of knowledge on your part, but you can get there. So don't accept anything less than feeling your best. If you're working with a doctor who is not helping you, who you feel is ignoring you, who you feel is trying to blame your symptoms on everything else except your thyroid, those are probably good signs that you need to seek out another opinion, go seek out another doctor, do whatever you can to help yourself to feel better. Because doctors, they're not you, right? They're treating you with the specific guidelines that they were taught, but they don't know what it's like to live a day in your shoes. And if you're living with fatigue and pain and weakness and hair loss and all these other things, you're the one who has to deal with that. Your doctor's not dealing with it. They don't know what it's like to deal with these things. So you need to, if you're living in that situation, you need to take your health into your own hands, take your thyroid into your own hands, read what I have written on my blog, check out my videos, do whatever you can to improve your health, to improve your outcome so that you can actually feel better. So I want you to know that it is possible to get back or very close to 100%. Sometimes it's not possible because of those fluctuations I mentioned previously, but it's a difference. There's a big difference between being at 70% of normal and being at 90 to 95% of normal. One is you might have a little bit of sluggish days. The other ones, you have really, really bad days. So keep all these things in mind if you have been newly diagnosed with thyroid disease, or if you have had thyroid disease for a long time but no one ever said these things. So hopefully you find this information helpful. If you have any questions on managing your thyroid, or why I pick these things, or anything like that, leave them in the questions below, or leave them in the comments below, and I'll do my best to answer those. And otherwise, that's all I have for you guys today. So I'll see you in the next one.